All right, so you've been digging into the world of these weight loss drugs, huh?
Mm-hmm.
Seems like you found some stuff about Novo Nordisk,
Yeah.
the company behind, what is it, Wegovy and Ozempic and
Ozempic, Saxenda,
Saxenda, yeah.
all the big ones. Yeah.
Some of this stuff is pretty interesting, even maybe a little concerning. This isn't just about like one company messing up or whatever.
Right.
It's about what all this means for the whole industry. So we're going to unpack some stuff about finances,
Okay.
some ethical questions
Mm-hmm.
about these weight loss jabs. So where do we even begin with all this?
Well, I think the best place to start is with the investigation itself. You know, researchers at University of Bath and Lund University
Okay.
spent over 100 hours
Wow.
going through like mountains of documents, websites, reports.
100 hours. That's serious dedication.
Oh, absolutely. It's not a small undertaking.
Not at all.
And what they found was that Novo Nordisk,
Okay.
they failed to disclose payments
Cool.
to a whole bunch of different organizations.
Like, how much are we talking about here?
Millions of pounds.
Millions.
Millions.
Yeah.
Yeah. We're talking over 1.2 million pounds
So like,
to healthcare organizations, patient organizations.
okay.
And these payments, they were either misreported, underreported, or just not reported at all.
Okay, so this is pretty bad already, but what really gets me is this isn't even the first time this has happened.
Back in 2023, they admitted to something similar.
Yeah.
They didn't disclose over 7.8 million pounds in payments.
See, this is what I don't get.
Yeah.
Get caught, they say they'll do better,
Yeah.
and then they still mess up.
And you know what's even more concerning?
Right.
Even after they did this big internal review, right, there were still discrepancies.
Like what kind of discrepancy?
An extra 635,000 pounds
Still unaccounted for.
unreported.
Wow.
And get this, they called their initial figures a best estimate.
A best estimate.
Yeah.
What does that even mean?
It just makes you wonder, right?
Yeah.
What systems do they actually have in place to make sure they're reporting this stuff accurately?
Well, and the timing of all this, it's kind of suspicious, don't you think? Like they launch Wegovy in the UK,
Uh-huh.
and suddenly all these undisclosed payments come to light. Makes you wonder if they were trying to,
Yeah.
keep things quiet.
And maybe avoid any bad press?
Exactly. What do you think about all this?
Well, I think it definitely raises some serious concerns.
Yeah.
You know, experts like Dr. Emily Ricard and Dr. Peter Zuransky,
Okay.
they've been pretty vocal about all this.
Yeah, they're worried about this eroding public trust.
Like, how can we trust these companies
Right.
if they're not being upfront about their financial dealings?
And it goes beyond just reputation.
What do you mean?
If we don't know about these financial ties, how can patients be sure that the decisions about what drugs they're being prescribed
Yeah,
are actually being made with their best interests in mind?
that's a really good point.
It's a big deal,
It is, and it's not just about transparency either.
right?
There are ethical concerns about how these weight loss jabs are being sold in the UK. The National Pharmacy Association, the NPA,
Mm-hmm.
they're saying that online sellers
Yeah.
are pushing clinicians
Pushing them hard.
to process way too many patients per hour.
Yeah, we're talking like more than 20 patients an hour.
20.
Well,
That's insane.
Think about it.
It's like 3 minutes per patient. Exactly, 3 minutes.
How can you possibly do a thorough assessment in that time? You can't go over their medical history,
No,
discuss the risks and benefits.
not properly.
Yeah.
It just raises so many red flags about patient safety.
And on top of that, the NPAs also found cases where these drugs
Mm-hmm.
are being prescribed to people who really shouldn't be taking them.
Like who?
Like people with a history of eating disorders
Oh, wow.
or people who are already underweight.
That is a huge concern.
Yeah.
These medications, they're powerful tools, but they're not for everyone.
No, definitely not.
And prescribing them without really thinking about the patient's individual needs, their vulnerabilities,
Yeah,
it could lead to some really serious consequences.
absolutely. So what does all this mean for our listeners?
Well, I think the biggest takeaway here is be careful.
Be careful.
Be a discerning consumer of information.
So
So,
what-
like, when you're reading about weight loss drugs,
Or really any health topic.
yeah,
Think about who's giving you that information. What are their biases? Are they trying to sell you something?
that's so important.
It is. And don't just rely on one source.
Right. Do your research. Look for different perspectives and talk to your doctor.
You need to be an active participant in that journey.